Hello everyone, this is Amir. Welcome back in the Hematology channel. Let's Bleep Hematology again. Today we will talk about monocytosis. We receive calls from other departments that the patient has monocytosis. Is this monocytic leukemia or CMML, chronic myelomonocytic leukemia? Please advise about that. So, like other abnormal full blood count, monocytosis has also hematological and non-hematological causes. We always exclude the non-hematological causes first. Now, what can lead to high monocyte count in your full blood count result? If a patient has any form of infection, like bacterial infection, viral infection, fungal infection, even parasitic infection, they can lead to high monocyte count. And we always compare the monocytosis with the previous results. How was the count a month ago or 3 months ago or 4 months ago? If it is persistent monocytosis and the patient has no infection related symptoms, then yes, then we have to check the blood film for this patient and may send the sample for flow cytometry as well. Other common cause of a high monocyte count is inflammatory diseases, the SLE, autoimmune disease, SLE, the rheumatoid arthritis. They can all lead to high monocyte count. Even stress, obesity can also lead to high monocyte count, and sometimes smoking as well. So there are multiple reactive causes of monocytosis. High monocyte count does not mean that it is CMML or monocytic or monoblastic AML in this patient. Yes, whenever the full blood count is abnormal, we request for a blood film to be seen to see if there is any leukoerythroblastic picture or if there is any promonocytes in this patient or not. And we compare the current results with the previous one, whether this is persistent or not. Because if we are talking about CMML, there is a criteria for diagnosis of the CMML, which I'm sure the hematologist will know. But calling every monocytosis hematology and that this is a hematological condition is not right. There are many conditions, reactive conditions that can lead to monocytosis in the patient, like chronic infections, which can be bacterial, viral, fungal, parasitic, or any anti-inflammatory condition like rheumatoid arthritis, SLE, other autoimmune conditions. They can lead to monocytosis as well. As we mentioned, smoking, obesity, stress, they are the rare condition of monocytosis in the patient. As a hematologist, your job is to check the blood film of the patient and to see whether it is persistent or not. And if the count is persistently elevated, monocytes are persistently elevated, then you have to apply WHO 2022 criteria to see whether it meets the CMML criteria or not. It can be it can be dysplastic, it can be myeloproliferative. This is for a hematology registrar and consultant. And you need to see whether there are any blasts in the blood film or not, to exclude monoblastic type of AML. So for the non-hematological stuff, if you see any monocytosis, please consider in your mind that different type of infections, different type of inflammatory diseases, stress, obesity, smoking, they all can lead to monocytosis. And for hematology colleagues, your job is to see full blood count first, exclude leukoerythroblastic picture, exclude presence of blast in the blood film, and send the peripheral blood to HMDS or your malignancy diagnostic service for flow cytometry. Thank you very much.